Hey everyone, welcome to your crash course on mastering ECGs. Whether you're a med student or just curious about heart rhythms, this guide will help you get the basics down. Alright, let's dive in. First up, what exactly is an ECG? An ECG, or electrocardiogram, is a test that records the electrical activity of your heart over a period of time. You've probably seen those squiggly lines before, but what do they mean? Each heartbeat generates an electrical impulse that travels through the heart. The ECG captures these impulses, giving us a visual representation of the heart's rhythm. Now let's break down the key components. First, you have the P wave. This little bump indicates atrial depolarization, basically the moment your atria contract. Next is the QRS complex. This trio of waves shows ventricular depolarization when your ventricles are doing their thing and pumping blood out. Finally, the T wave. This reflects ventricular repolarization, the recovery phase before the next beat. Now there are different types of heart rhythms and each has its unique ECG pattern. Let's talk about a few common ones. First, atrial fibrillation, or AFib. On an ECG, AFib looks like a chaotic mess. Instead of a regular rhythm, you'll see irregular QRS complexes with no distinct P waves. This happens when the atria are out of sync, kind of like a crowd doing the wave at different times. Next up, ventricular tachycardia, or VTach. This one looks like a series of wide, bizarre QRS complexes. It's the heart racing out of control, and it can be a medical emergency. Imagine your heart is a car stuck in overdrive. It's not sustainable for long. Then, there's normal sinus rhythm. This is what you want to see. Regular P waves followed by QRS complexes in a consistent pattern. It's your heart's business as usual mode. To read an ECG, you start by looking at the rhythm, regular or irregular. Then, check the rate. Is it too fast, too slow, or just right? Next, examine the P waves, the QRS complexes, and the T waves. Make sure they're where they should be, and look how they should look. Remember, practice makes perfect. The more ECGs you read, the more familiar these patterns will become. So grab some practice strips and start analyzing. Alright, that wraps up our quick guide to mastering ECGs. If you found this helpful, hit that like button and subscribe for more medical insights. Thanks for watching, and see you next time.